Then I asked this question. I said, from that monies that the 8 out of 10 that is under or unemployed, how much money would we have earned in Saskatchewan if we would have been representatively hired? The same as non-Aboriginal. They said last year, we would have earned $750 million in wages, and we would have paid $250 million income tax. So Stats Canada is telling me that by not having a strategy, some of the stuff that's going on, which we're going to explain today, is not a strategy. Then it costs us $2 billion a year of our tax dollars, non-Aboriginal people included, that say, what's this got to do with me? We pay higher taxes by not having a strategy for 13% or whatever the population number is. So we were arguing that what we need to do is take that negative spending and better spend the funds. And we need to get Aboriginal people ready differently, that they can integrate on their terms to be able to compete and stand in line and win competitions like everybody else. That immigration is not our long-term strategy, it's our short-term strategy. We use immigration to fill the void that we have now, doctors, other kinds, nurses, other kinds of classifications. But in the longer term, we get Aboriginal people ready so that they can stand in line and participate. Now, representative workforce, I hear the argument, and just sitting there thinking of this. You know, we can argue representative, what does it mean? And I'm not going to use, like government does, and use employment equity numbers to judge success. It meant to us that we have representatively hired entry, middle, senior management in all departments, crowns, throughout our system, okay, that representatively would be hired. But another statistic you could use this way, that representative would be that our jails would be no fuller than 8%, like the provincial population, that our dropout rate would be no different than the non-Aboriginal people, that people that are in trouble would be no different than non-Aboriginal. You see, I'll go back to the argument that I was going to use, even before I get into my paperwork, about the role model argument that everybody uses to divert what we're doing, because they only figure out about 20% of the Aboriginal people, but they forget about the 80% that they left at home. And the argument was, they come to myself and Doreen and Victoria and others and says, show me your role models. So we'd scour the community to try find 10 and build posters for them and put them on the walls. And I was opposed to it, always have been, because I'll tell you why. It's how they're used. Where people come back to us and say, well, you know, Hampton and Victoria and Wayne, you made it. Why can't all the others? Why can't they be like you? And you know, they use it as an argument. People use this as an argument to pretend that if Hampton and Victoria and Wayne and others made it, then all the barriers must be removed. It's something like the argument in America, now that Barack Obama is elected as president, obviously there's no more racism, right? So I'd say, no, no, no. You see, Aboriginal people were using it the wrong way. The argument is that today, yes, we'll show you our exceptionals. They're exceptional. It's not that the barriers are removed. It's that I, as one, don't accept no for an answer. I figure out how to get around all barriers, and everybody's come to me over the years, Wayne, you can't do this, Wayne, you can't do that. If you tell me I can't do it, I'm going to do it. I'm going to figure out how to do it. And we're not going to accept no for an answer because our community is in trouble. And we don't have the people standing up the way they should stand up for our communities. And the statistics I put there says that I'm right. That I don't care what anybody says to you, that we're doing a good job, I'm going to tell them they're lying. That statistic says there's nobody higher than 50%. Nobody. And anything to do with 50% poverty means that we're in severe trouble in those communities. Severe. Okay? So the argument was, this should be the argument. Today we'll show you our exceptionals, but tomorrow it should be the rule. We got to worry about the 90% you left at home, so I can show you one role model. What about the other 99 that I didn't show you? Okay, another statistic that wasn't brought up yet is, did you know that when you look at those stats, that 51,000 new Aboriginal people will become of working force age in the next 7 years? That's since '06. So we got 3 years left. Those people are moving into working force age. What doors are open for them? What workplaces are open? So the more partners we signed, yes, we signed. We didn't have the success that maybe some other people thought they had, but we're getting ready workplaces Not all were at the same pace. The university was different than healthcare. All did different things, but they were at least focused on the end result, and the end result was they'd have a workplace that's accessible. They would have a workplace that doesn't provide an unfair advantage to one community over another. They would have a workplace that when there was barriers, develop a dispute mechanism so we could at least sit down and talk about them, not have them ignored. Those were the changes that we asked the employers to start looking at. And I'll give you something else about success. Success to me means, in this strategy, and healthcare can take a lot of the credit as the unions can. Did you know today in healthcare we have 800 Aboriginal people in the health sciences, students? 800. So I can't get you a Nurse Friday when the people want them. But over time, that was the agreement we had, that we would start to convince Aboriginal people that this workplace is going to become a workplace of choice, it's going to become a friendly environment, it's going to have retention strategies, it's going to have career pathing strategies, and it's good for you to invest your money there because you won't go back on welfare after you finished your training. The training won't be make work. It'll be actually training that provides you the skills to stand in line and compete with all other Canadians. That's the argument that we put forward. Now, 800 might not mean a lot, so I couldn't use the numbers, but I know that even in healthcare, when I checked, over 3,000 people have been hired since 1998. Come and gone. There are not 3,000 left, but 3,000 were hired. You can't name me another workplace, another sector in Saskatchewan that has those kind of numbers. You can't name me a success like this, that 40,000 Aboriginal people, 40,000 non-Aboriginal and Aboriginal people in healthcare in particular went through misconception training. 40,000. Got a different understanding of the treaties and the aspirations of First Nation people and the aspirations of Métis and the contributions they made and the struggles they've had and how they want to now become, again, where they're dependent, how they want to return to become independent. And that we'll get rid of these myths that Aboriginal people don't pay tax and they get free education and they always come late for work. We get rid of those myths so people know this too, that on all those floors that were participating Aboriginal people, we said, I want you to talk to the non-Aboriginal people and let them know this, that was caused by another program, this misinformation, was that when you see an Aboriginal person on your floor, it's not because they were a quota or a set-aside or a target. It means that somehow we got advanced information to those Aboriginal people. They went out and got the skills. They stood in line and competed and won the competition. That's why they're on your floor. Not because of your goodwill. It was because of their good marks that got them there, and that's the changes that we wanted to argue about. And we told those kids learning should lead to earning, not this training where we train rec tech workers and when they're finished they go back on welfare and there's no job at the end of it. Okay? There's a paragraph that I want to read to you before I get to the next part, and I want to go down the representative workforce argument, but I wrote this out because knowing that this process was coming, I thought the Aboriginal community, or the non-Aboriginals, got to understand the journey that we're in here and the barriers and the people that stand in line, because all the professionals know how to say no. This is what they're doing to us. They cut these programs that are working, by the way, that were designed by Aboriginal people. This strategy was not designed by non-Aboriginal government officials. It was designed by Aboriginal people in the partnership workplaces that we went to, and the Aboriginal people within government, including the agent representatives, the Aboriginal Government Employees Network, along with Aboriginal people in organized labor. I want to read this paragraph. It's about the success of Aboriginal workers. And I wrote this because I was doing some work for the Northeast section when we did the work here for the bands in the Nipawin area. And I wrote this, it says, economic success for Aboriginal workers means more than having a good job. It means gaining their self-respect. It means being able to walk among and with other citizens, holding their heads. It means being able to provide your family with a good solid house which fills the needs of your family. It means being able to furnish that house to make it a home where you and your children are comfortable in bringing both your Aboriginal and non-Aboriginal friends. It means being able to provide for yourself and your children the education and training necessary to be able to continue the journey tomorrow, next year, and 10 years from now.